Hi, my name is Dr. Ayla Gordon. I work as part of the Marietta Memorial Pulmonary Department and the Critical Care Department. So I have my outpatient pulmonary clinic. I also see pulmonary patients in the hospital, and I also run the ICU in the hospital. Initially, when the Mayo Clinic Care Network was told to us, we were sort of excited and also hesitant. Didn't really know how it would affect us. So initially, right off the bat, there are always complicated cases that come through, difficult cases or rare cases that we don't see every day. We don't necessarily know how to diagnose or treat some of these more rare cases, and that's where these external resources help us. The second I had a really difficult case, and it was multiple different specialties that were struggling. We had medical oncology involved, we had surgical oncology involved, and we were all sort of struggling with this case. And within a week, not only did they have a pathologist to take a look at it, they even had an oncologist to be able to look at the entire case from beginning to end and help us make sure that, one, we had the correct diagnosis, and two, our treatment plan was in line with what they would also do. And with these difficult cases, every so often, you just need that second person to say, you got it, correct, go forth. I didn't necessarily know how fast things were going to take, how long it would take for me to get a response. And so within a week, I realized that there was a communication and it was an open conversation. I was able to call the representative that was dealing with my case and say, hey, where are we at? Has this been looked at yet? Has this been discussed yet? And they were even able to give me a response and say, we are actually having an entire conference to discuss this case because we agree with you, this is not an easy case. And so that open communication was imperative initially. Being part of the Mayo Clinic Care Network actually gives us access to a lot of different tools. But there are all different types of educational resources that are available both for physicians to learn from, but also for patients. And there are different types of opportunities for people to learn. And so sometimes as physicians, we can take part at conferences at Mayo Clinic and be able to be at their tumor boards, to be at these different academic programs that they run that we don't necessarily run. And in the same breath, patients also have access to the same amount of information that Mayo Clinic patients can have access to. And that's really important in a world where this is a conversation, and the more patients know, the more physicians know, the more we can have a conversation about the best care that can take place.